Understanding abscess drainage costs for diverticular disease. When it comes to diverticular disease, particularly diverticulitis with abscess formation, understanding the costs associated with abscess drainage is crucial. Abscess drainage is often necessary when a localized collection of infected fluid forms in the abdomen or pelvis. This procedure is typically done percutaneously, which means through the skin, using imaging guidance like computed tomography or ultrasound. This method allows for the placement of a catheter to remove the infected fluid without needing open surgery. The costs for this procedure can vary widely. For those without insurance, home care with oral antibiotics might cost under $500. However, if hospitalization is required, especially with intravenous antibiotics and abscess drainage, expenses can soar to $10,000 or more. If surgical intervention follows, which is common, costs can range from $30,000 to $50,000 or even higher. For patients with insurance, out-of-pocket expenses typically include copays for doctor visits, prescriptions, hospital stays, and coinsurance for surgery. This can range from 10% to 50% of total costs until reaching yearly maximums. Percutaneous abscess drainage is a minimally invasive procedure performed by an interventional radiologist. This approach uses imaging guidance to insert a small catheter into the abscess. It avoids the need for open surgery and usually requires just a small skin nick, which typically does not need stitches. Recovery time is generally faster compared to traditional surgery. The drainage catheter may remain in place for about a week to ensure complete removal of the infected fluid. Clinically, abscesses larger than 3 to 4 centimeters are often managed with percutaneous drainage along with antibiotics. This dual approach addresses the immediate infection and reduces the risk of sepsis. It often serves as a bridge to elective surgery to remove the affected segment of the colon. However, in some high-risk patients, drainage alone may be sufficient without the need for surgery. Financially, the cost of percutaneous drainage includes several components. These are imaging guidance, the interventional radiologist's fees, charges from the hospital or outpatient facility, and follow-up care. While these costs can be significant, they are generally less than those associated with open surgical drainage or emergency surgery. Hospital stays for complications from diverticulitis typically average around 5 days, which adds to the overall expenses. In summary, the costs associated with abscess drainage in diverticular disease depend on various factors, including the size of the abscess, the treatment approach, insurance status, and hospital charges. Minimally invasive percutaneous drainage is often a cost-effective and safer alternative to surgery for many patients, although surgery may still be necessary later. It is essential for patients to discuss their treatment plans and expected costs with their healthcare providers and insurance companies to fully understand the financial implications.